Hello everyone. Today we will discuss antimalarial drug therapy part 2. We have seen the common antimalarial drugs, their mechanism of action, pharmacokinetics and side effects and contraindication in the previous video. Today we will see about the treatment regimens for each of the infections. So all the Plasmodium falciparum cases, that is a patient infected with Plasmodium falciparum, are treated with artemisinin based combination therapy. This artemisinin based combination therapy is given both in the government as well as in the private settings. Okay. So they are treated with artemisinin based combination therapy both in the private as well as in the government sector. The mixed infections, that is by a person infected with both vivax and falciparum, are treated with artemisinin based combination therapy and the 14-day regimen of primaquine. Okay, so mixed infections. Okay. Next we will see the treatment regimen for each of the parasitic infections. When the patient is infected with uncomplicated Plasmodium vivax infection, so treatment regimen of uncomplicated Plasmodium vivax infection. So we give the drugs such as chloroquine, and primaquine. So the dose of chloroquine is calculated based upon its base. Okay. So it is 0 hour, 6 hour, 24 and 48 hours. So regimen number 1. So when the patient is diagnosed to have malaria, infected with the person infected with Plasmodium vivax, so we give at the time of diagnosis chloroquine at the dose of 10 mg per kg and repeat the dose of 10 mg per kg after 24 hours and again with 5 mg per kg after 48 hours. So total of it is 25 mg per kg. Okay. Regimen 2, here you can give it as 10 mg per kg at the time of diagnosis and 5 mg per kg after 6 hours and another 5 mg per kg at 24 hours and 5 mg per kg after 48 hours, and this also total dose constitute about 25 mg per kg. Then you give primaquine at the dose of 0.25 mg per kg. OD dose is given for about 14 days. This primaquine is given to prevent the relapse. Okay, this is the treatment regimen of the patients infected with uncomplicated Plasmodium vivax infection. Next we will see the treatment regimen for uncomplicated Plasmodium falciparum infection. So treatment regimen of uncomplicated Plasmodium falciparum infection. So this both in Plasmodium falciparum, whether it is complicated or uncomplicated, we use artemisinin based combination treatment regimen is being used everywhere. So regimen number 1. So regimen number 1 consists of artesunate along with sulfadoxine and pyrimethamine. So artesunate we use at the dose of 4 mg per kg. It is given for 3 days, while that of sulfadoxine is given in the dose of 25 mg per kg, and pyrimethamine is given at the dose of 1.25 mg per kg. This is given for 1 day. Along with this, we give primaquine at the dose of 0.75 mg per kg. This is given as single dose. 0.75 mg per kg. This is given as single dose. While in uncomplicated falciparum vivax infection, we give it for 14 days. While in uncomplicated Plasmodium falciparum, we give it as single dose. Okay. Next, we'll go on for regimen number 2. So in regimen number 2, we use artesunate with mefloquine. These are artesunate with mefloquine. Artesunate is given in the dose of 4 mg per kg for duration is 3 days. Mefloquine is given at the dose of 15 mg per kg on day 2 and 10 mg per kg on day 3. Along with this, we give this primaquine also. This primaquine is being added at the dose of 0.75 mg per kg as a single dose on day 2. Okay. This is regimen number 2. Next, the regimen number 3. Regimen number 1 is being used in all the states in India except in the northeastern states. In northeastern states, we use artemether plus lumefantrine. That is regimen number 3. Artemether with lumefantrine. Artemether dose is 20 mg and lumefantrine we'll get it in the tablet form as 120 mg. These are calculated as per their body weight. This is given for 3 days along with primaquine. That is a single dose. This is the third regimen. Okay. These are the regimens for treatment of uncomplicated Plasmodium falciparum infection. Next, we will see the treatment options for complicated and severe malaria. Treatment regimens for complicated and severe malaria. To make it simple, I have written only one regimen which we are using it all over the states of India except in the northeastern states. So you start with artesunate. It is given at the dose of 3 mg per kg in children with body weight of less than or equal to 20 kg. It is given at the dose of 2.4 mg per kg when they are more than 20 kg of body weight. It is given as IV stat, and then this same dose is continued at 12 hours and 24 hours, followed by once a day for 7 days. Okay. Once the patient can swallow, the treatment is completed by giving a course of this artesunate with sulfadoxine and pyrimethamine as an oral dose. Even when the patient can be able to swallow the drugs in the complicated and severe type of malaria, we give artesunate the starting dose as IV only. Okay, we do not give it in a oral form for complicated and severe malaria patients, even when they can swallow. Okay, understood? So once a patient can swallow, the treatment is completed by giving a course of artesunate with sulfadoxine and pyrimethamine tablet. Okay, so this is about the treatment regimens for uncomplicated Plasmodium vivax infection, uncomplicated Plasmodium falciparum, and complicated and severe malaria. So the in comment section you have asked for the PDF of these notes. I will be posting this PDF of these notes in my Instagram page, that is Dr.Vidhu_Varsha. This is my Insta page, and also in the Telegram group. As it's PEATS University Exam Discussion Group. So kindly do follow these pages for the PDF of the following notes, all the notes that previous videos I have taken, that even that notes I have been